Welcome to the Simply Mindful Wellness Podcast. Join your host, Tracy, the Mindful Wellness Coach, as she takes a deeper look into nourishing your body, mind, and soul. Because being well creates the freedom to live life the way you want.
Hello and welcome to another episode of the Simply Mindful Wellness Podcast. I'm your host, Tracy Richardson, the Mindful Wellness Coach and Holistic Health Practitioner and owner of hybrid therapy. So welcome to our listeners and our watchers over on YouTube. Today I'm joined by Holly Middleton from Flow Movement, all the way out in Canada. And we'll be talking about movement and anatomy in motion. So welcome. How are you today, Holly?
Oh, thanks for having me. It's great. I'm in Vancouver, like you said, and we're having a beautiful sunny day, which is, we're kind of spoiled because, our weather here is much like it is in the UK, raining all the time. So we're cherishing it. We have a bit of amnesia when it's sunny. We're like, oh yeah, I forgot about the rain. So we're having another glorious day today.
Oh, sounds wonderful. So I'm so interested to talk to you today about movement, because for me, it keeps us in our flow and so on. So I'd just like to get you to share with the listeners who you are and what you do and why you do it.
Sure. I'm Holly Middleton. As you said, I am a movement coach. And so what I do is I empower people to be able to get themselves well by teaching them how to move better. And as we were talking a few moments ago, there's many things that we just don't know that we don't know. And that's what I help, is to shine a light on the things in your body that you're not even aware of that are or aren't happening. And we own our bodies all day long. We walk around in them and we live in them and we experience them. But there's things that our body has just deleted from our awareness that we want to start bringing back, because those are the key to us being able to feel well again. And that can be, I didn't know that my knee was doing that. I didn't know that my jaw was doing that. And those are the pieces of the puzzle that we want to bring back to your body so that your body can go back to its factory settings and do its thing. I want my patients, my clients, to be able to live their active lives and not be held back by frustrating pain that they've chased through every door of every practitioner and haven't had the aha moment or the person tell them why they're feeling the way they are. So I help shine a light on why you're feeling the way you are and how to help you find your own way back to feeling well. So I want to be able to empower people to do that. And I do that through, as you said, anatomy and motion is my main modality. But I also work on breathing mechanics, pelvic floor, and a whole bunch of different things connected together to help you find your way into being able to do the things you want to do and not being frustrated or held back by them.
Oh, fantastic. So I love that. It's about empowering people rather than, doing it for them. So essentially, you could say that like everything that's happened to you, everything in your body is a reflection of what's happened to you since you were born. Some people say it's handed down through generations, and all the compensatory patterns that are keeping you alive and maintaining the status quo. So how do you work then with people to try and help them make better choices, essentially, so that they can get out of these stuck patterns?
Yeah, so I start off with a full history. So I want to know the connections between things. I want to know when, for example, you fell off your tricycle as a kid and bumped your head, how that changed how you stood from that moment on. I want to know that you had, let's say, a tattoo that you protected for a while. And so you changed the way that you moved because you were protecting that area that was painful. I want to know the emotional aspects of your life. So if you were anxious or depressed and you spent all of your time gaming on the couch and you sit in a C shape looking like a croissant, then that would emotionally affect your ability to stand and get out of that position. But also you've become a master of sitting in a certain type of position. So I want to know all of these things and start connecting the dots between those. So I want to know when you bumped your head as a little kid and it changed how you stood, because that was just a force that changed your posture. Is that when your symptoms started? So we're connecting together, not just that you would come in and say, I have a sore knee, I want to figure it out, but I want to know why you have a sore knee. It's probably not the knee at all. It's probably something else. And the knee is just the canary in the coal mine that's told you this is something to pay attention to. But because we don't really have an understanding of how our body's put together, and the fact that dental surgery can be affecting something as far away as your heel, right? Because you didn't chew on that side and you were ginger about the injury there. And so you started, I mean, what do we do more than breathing is like chewing and talking, right? And so that's going to be influencing the jaw. And so all the way down the chain, something down there, it could be anything along the way, will have changed how it moves, changed what its job is, and then eventually it's going to go, hey, I don't like having to do this other body part's job anymore. And so we're connecting the dots between those. I want to know how you stand when you're at rest. So I know how you manage your body against gravity. Because for you, the way you stand without thinking about it is where all your center is everywhere. So the center of all your joints, based on your perception of where that is, that's going to show up in the way you stand. And if your shoulders are off kilter like this, and that feels like neutral, natural, normal to you, then we want to show your nervous system that that's not actually where center is, and give it some more potential and some more movements that it's going to be capable of doing to try to alleviate that. And we just simply don't know, because you live in your body all day long, and the way you stand, the way you move feels normal. It feels neutral. It feels just like your default. But what we don't know is what we don't know. That actually isn't, that your body's gone through a negotiation with every injury. That if you banged your knee and then you had dental surgery and then you pulled a muscle in your back, each one of those is going to go, okay, but now that this new guy is on the scene, we all have to decide how we're going to manage each other. And so they all build and build and build on each other until you end up with who you are today, which is an efficient human. You're getting the stuff done, but something's bothering you enough that you're like, I have to do something about this. But it's not when we first got the injury. Because many people will say, oh, I sprained my ankle many times. What did you do about it? Well, I just sort of iced it and limped and then got on with it. And I'm like, but then what else has happened because of that? What did you not do to help your body go back to the way it was before? That maybe now is the reason you're feeling the way you are. So we kind of go down that rabbit hole, take a deep dive into the reasons why these things may be connected together, so that I have an inroad, so I know where to start. Then I will do a screening to understand, how do you move around your neutral, where your neutral is? Can you move left and right, up and down, rotate around that? Or is that preventing you from accessing some of that movement that may be something that will feel good, that your brain will really like? And then I also look at your gait. So anatomy in motion is a big focus on gait. So walking is one of the most fundamental human movements that most of us do. And we want to know how you walk, because if you can access those movements while you walk, well, that's an interesting piece of information, that you're able to do it under momentum, but maybe you can't get out of that motion when you're standing still. So we want to understand that. And then, of course, everything scales up from your walk. So your walk informs how you run, how you squat, how you reach for things, how you do everything in your life. And so we want to understand how improving your walk, not by teaching you how to walk, but by bringing back the movements so that when you walk better, that will help you do everything else in your life better. So it's a bit of a deep dive into the nitty-gritties of who you are as a human, the negotiations your body's gone through to help you get back things that your brain might like having back again.
Oh, absolutely. And I don't know about you, but since becoming a practitioner, I'm a people watcher, but I watch them in a totally different way now. Honestly, people walking down the street and you're like, assessing all the time.
Yeah. And every time you take a course, you notice something new too.
Oh, for sure. And like you were saying, it's all about like trying to get the body in the state that it likes. So making it feel safe. And as soon as it feels safe, essentially, it does the things that it needs to do, because it could have been living in fear, like you say, from the age of 3 since you fell off your trike or whatever happened to you. And I think we don't always look back, do we, at what has occurred to us over these periods of time. Like you were saying, I've sprained my ankle a number of times. Okay, so when was the first time? And, it could have been age 5, age 6, and you've just not recalled that, but yet that issue, that compensatory pattern has been there since.
Yeah.
So where do you start then with all of this? Obviously, you do your screening and so on. So where do you start? Do you start at the top? Do you start at the bottom? Do you start somewhere in the middle?
That is the big question, because Anatomy in Motion, and Gary Ward is the founder of Anatomy in Motion. He came up with the flow motion model, which is the basis for the practice. He says that Anatomy in Motion is not it's not a technique, it's a thought process. So it's not like a dichotomous tree where if this, then that. So if this is happening, then do this. If this gets better, then do this, and then do this and this, and then you're good. It's a thought process. It's what is and isn't there in terms of the movements that the body is designed to do, and what is the big picture thing that I can bring back to the body that will be the most impactful in the moment. And so that's a clinical reasoning skill that takes lots of practice to be able to figure out, lots of trial and error, and it's really client specific. So this as a practitioner, that some bodies are just totally game for movement. They're like, yep, give me a movement, I'm going to love it, let's do it, I'll do it all day, fantastic, on with my day. Others are like, nope, not moving that, not going there, will not do it. And sometimes it's because you've looked in the wrong spot, that the handbrake, the thing stopping you, is not where you're working. You have to look further up or down the chain, and that's cool. That's one clinical reasoning thing to learn. And the other is your nervous system is just saying, no, get out of here. And I've had clients who say, this exercise, I want to run from the room screaming. I don't want to do this. I absolutely do not. My body is screaming at me to stop this. And that's trauma. Mm-hmm. That's just your body saying, I've protected the human for this long. And not moving that thing is protecting the human from that awful, terrible thing that happened 40 years ago, whenever it was.
Oh, for sure.
And so our body will just say no until you show it that it's safe. And we know this with lots of other things in our lives, that the more times you do it, the more times it's not awful, the more you go, okay, it's not so bad. Okay, maybe I'll try it again. So sometimes bodies are immediately just accepting of things, and they're like, oh, great, yes, I will do that. And they love it. And other bodies are like, nope, for sure. Not now, maybe not tomorrow, but soon. But you just have to find the inroad to allow them to know that it's safe and give them the time and space. So patience. And I always tell my clients that I don't expect anything in the first visit. No expectations from me, because I get frustrated, you get frustrated. And sometimes the body will just say, no, 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 no. And then one day the pain is just gone. And you have no idea. We have body amnesia too. I've had people who come in and they say, oh, I have this foot pain and it's stopping me from going for walks. It's stopped me from gardening. It's just awful. I've gone to all these people and it's never getting better. And I guess it's just always going to be there. And we work for a little bit and things get better and better and better. And then they come in, oh, my hip is hurting. And we go, well, how's your foot? What do you mean my foot? I said, well, you came to me because it was life altering. Oh yeah, I forgot about that. How did you forget about something that was so life-altering? It's just amazing how the body can just forget these things. It can conveniently forget huge injuries. Like people have told me, oh yeah, I totally forgot I got ejected from a truck and landed on my head. Well,
sure.
Clever body to forget about a serious injury like that so that you can get on with your day. But also, I moved your big toe and that's how you remembered that? That's fascinating. But just things that we don't know about the body and its ability to be resilient and get on with things, sort its way out of injuries and these negotiations and cleverly forget things so you can get on with it.
Absolutely. Well, it's always trying to keep us alive. And I think that's something that we forget, isn't it? That these compensatory patterns or these symptoms that occur or these things that are happening to us, our body is just trying to keep us going. It's not an inconvenience, it's a message, it's trying to tell us something. But as you said previously, we just get out of the habit of listening, or we don't know what to listen to. We don't know what we don't know. And then you go and see a practitioner and they don't know. So I'm a great believer in, just because someone's come to the extent of their knowledge doesn't mean that there's nothing that can be done. There's always someone else that knows something different or can try something different, because we can't know everything.
Yeah, and I have people who say, I've tried everything.
Yeah.
I'm like, well, you haven't tried everything because you never met me before.
Exactly.
And the thing that I do is not that common. We don't have a ton of practitioners around the world. We are around the world, but we're not nearly as well known as some of these other modalities.
Mm-hmm.
And if you haven't, and I ask people, have you had anyone take a deep dive into how you move every part of your body and how you can connect them together? Has anyone done a gait analysis where they've looked at every joint in every phase of gait on the left and the right to see what you can and can't move? Has anyone ever looked at your fibula? Has anyone ever looked at how you move your feet? Have they ever looked at those things?
Yes. I'm fascinated by feet and repulsed in equal measure. I love their influence on our function and so on, and their structure. I just don't like touching them.
Okay. Yeah.
So let's talk about feet then, because obviously they have a huge influence on us and our movement, particularly our walking patterns and our posture and so on. So how would you then deal with somebody that came in and start off with their feet? What sort of things would you be looking for?
Yeah, so a big component of anatomy and motion is also foot function. So we look at every joint in the body, including all the joints in your feet, in 3 planes of motion. And so Gary Ward's teaching, he talks about 2 shapes that our body makes: pronation and supination. And so pronation, very simply, is all of the arches of your feet dropping down to the ground, and your foot gets longer and wider. So your foot, it would all the arches would come down, it would flatten out, and your foot would get longer, and it also gets wider as everything spreads. And then our supination is the opposite of that. So going from your pronation, where everything's spread out, then your supination is all your arches lifting up, and your foot is getting narrower and shorter. And both of those need to happen with a tripod on the ground. So you want to have, now this is a hand, it's analogous. You want to have the ball of your big toe, the ball of your little toe, and the back of your heel, ideally as your tripod on the ground. And many of us come in to see our practitioners with some of those components missing. So either some of the joints in the foot are not moving to create the pronation or supination, or they're missing the tripod. So maybe their tripod, instead of being nice and wide here, you think of like a camera on a tripod. If you had the legs in really narrow, it would fall over with a breeze, right? But if they're nice and wide, it's much more stable. So same thing with your foot. If your tripod is like an ice skate, then you're not going to be very stable on your feet. Nor is your nervous system, your brain, going to be saying, I like that foundation underneath me, let's trust it. It's just not going to trust it. So it's going to have to do a bunch of other things to try to make movements and get you moving around. And the fascinating thing about the foot is that it is both mobile, just like our hands, right? Has all of these abilities to move. So it can meld itself over any structure that you stand on. And historically, we would have never had flat level floors everywhere. We would have had knobbly things we're constantly having to deal with. But it's also can get rigid. So when you pronate, it's able to meld itself to anything. And then when you supinate, it stiffens. All those joints lock together. They're designed to lock together to get stiff just in the structure of the bones themselves. And those 2 movements, if you do them nice and well, they cascade all the way up into the body to get the efficiency of all of the movements and the structures above it to help and communicate back and forth. And so what I often see is people will come in and I'll assess pronation and supination without saying I'm doing that. Like bend your knees, straighten your knees, lift your toes, these little cues that I give. And people will not be able to get cleanly into a pronation and a supination. So they may be that joints are stuck, or that their nervous system has forgotten how to do it, or a compensation, or I don't like the word, the negotiation has caused them to avoid moving certain bones or getting pressure into certain parts of their feet. And so I'm looking at, where is your tripod? Can you maintain a nice tripod? Can you pronate and drop all those arches and get a nice long wide foot? And can you lift the arches up and still keep your tripod? And does your leg respond to those movements? So from your ankle, your leg bones, your hips, do you respond to something happening in your feet? Or is it like your feet were cut off at the ankles and something happens in your feet and then your body just goes, I don't know. I don't know. Something happened. I don't know. Something happened down there. And often it's injuries, experiences in our lives cause our feet to change. So I don't like to talk about shoes necessarily, because I think we should be the boss of our feet rather than blaming it on other things. But sometimes it's footwear, sometimes it's injuries, but sometimes it's just simply that our body has decided, we've decided for our bodies that that movement is wrong. My knees should never go in towards the middle. They should always stay over my second toe. I shouldn't stand in a certain way because as a woman, I got more attention, right? These sorts of things. I should hold my tummy in because I shouldn't have a gut. Like these things that we assume and or take on from society, or things that we're told. So many, many times I'll ask people to do a movement that gets their feet to move, and their feet don't move. And I ask them why. They're like, oh, well, so-and-so told me that I'm overpronated, so I shouldn't move my arches, or my knees should never go in towards my big toes. And so someone has told them something that stopped them from a natural movement in their bodies. And so we can be our own worst enemies, right? We can tell ourselves these stories about how my body should be, but it's not actually true.
For sure.
And then we start unraveling these things. Yoga practitioners that think they have to be extremely extended in their backs because this is good posture, right? These sorts of things that we're told of ourselves, that this is what good bodies are. And then you have to show them that a happy, resilient body is a body that can access everything it needs to when it needs to.
Oh, for sure.
That if I can do this thing when it calls me upon me, my body's going to be happy. If I step off a curb and I can't move my foot, well, would you like to be able to not roll your ankle when you walk off a curb? Yes, please. Right? So these little things that it's like, if I can show your body what it's capable of, it will pull from those things, and it's prepared to do it when it's called upon, rather than, well, I was told this and this and this. And I often get these stories. You probably get these stories too, of my body shouldn't, or this shouldn't.
I think a lot of it is social conditioning, as you said. A lot of it is because that's the way it's always been. A lot of it is because so-and-so said so, and that's the way it is. And it's changing paradigms, really, with a lot of, I think, what modern practitioners are doing. We're bringing in a lot of different influences. And as you were saying there, everything affects everything. So the things that go on in the foot affect everything all the way on up, like you were saying, all up to the head, neck position, loads and loads of stuff going on there. So we've established then that posture and the way we are from our feet can influence our wellness. So how does walking specifically influence us then, and how we can be well-beings?
Well, walking, like I said, is one of our most fundamental human activities. And walking, paraphrasing other people, is one of the most healthy things you can do. Your body craves it. It's what we would have done ancestrally a lot. We would have walked, I think it was something like 3 to 10 miles a day every day. It's just what we would have done.
Do that now.
Yeah, how many people could? The people that come into my practice, the other hat that I wear is a physio assistant, and many people come in and they just don't have any activity in their lives. And our bodies are designed, they love movement. If someone once said, if you interviewed your bones and said, what do you love? They say, well, I love gravity. Because we want to always be dealing with gravity. It's what we're meant to do. Gravity helps us propel. It helps us load our muscles. It helps us get around, and it helps us with our blood, our lymph. All of our tissues require the gravity all the time. And so walking it's a fundamental human activity that we should do, and carrying stuff too, right? Carrying kids, carrying baskets, carrying water, carrying supplies. We should be walking at least 3 miles a day. It's just our natural baseline human activity. And so when we do that, when we walk a normal human amount every day, it gets the stuff done that your body needs. it loads the tissues. It keeps the tone in everything. It reminds your body how to move. You're walking over uneven surfaces. Ancestrally, we would have. So it loads all the tissues. It helps your balance. It teaches all of the things. It reminds your body all the things it's supposed to do. But if we live in an anti-gravity type of situation all the time, sitting is an anti-gravity situation. We don't load our bodies and use gravity all the time. We would have chopped things and stirred things and carried things and pushed things and swung from things. And we just live in an anti-gravity. I think there was a book I read about how humans live in anti-gravity, right? Almost like astronauts. Everything's holding us up. Our bras are holding up our breasts, right? We're being held up all the time. And so we've just got this it's more efficient for us to have other things do gravity for us when our bodies are craving it all day long. And so walking is one of those things, swinging your arms. And I took a course a few weeks ago that said that because our torsos are imbalanced, that just the organs are different left and right, is something that we are supposed to be contending with all day long. We are supposed to be dealing with the fact that our left and right chest cavities have different stuff in them, that have different densities, buoyancies, and in different places. And we're supposed to move around and walk and swing and things to manage that all day long. But we sit in this perfect ergonomic situation where everything is aligned and nothing is tilted, which means that you never challenge the fact that you're not balanced. And walking is the perfect antidote to that, because you have to deal with, my liver is heavier, and then my heart is over here. My liver is heavier, and back and forth, and swinging your arms and carrying things. It's simple, it's free, it's accessible to pretty much everyone, that we can do that activity. And the benefits, I mean, there's books that I haven't read yet. You know how we love books to read about the benefits of walking and just how simple and accessible it is.
Yeah, for sure. And I think that you mentioned quite a few things there that people don't think about or don't know to think about when we're walking. They just think about the cardiovascular benefits or the breathing and so on, which we'll come on to in a second about breathing. But we've not been trained, actually. Yes, it's applying a load to your bones. We get a piezoelectric effect, which influences like ionic flow and stuff like that. And everything that you were saying there with the organs need pitch, roll and yaw to function properly. They're not just kind of blocks that just sit there. They have fluids that move in and out, and they need that flux and so on. And it's just one of those real fascinating things to me, that actually movement is so much, and like you say, it's accessible to everybody, and for those people that are unable to walk, we can breathe. So we're just going to talk a little bit about breathing, because I know this is one of the things that you're really passionate about as well. So it's obviously so important, we need to breathe, but how do we breathe? How should we breathe? Like, should we just do it, or are there certain ways that you would suggest are better?
That's a very deep dive, that question. My perspective, and I'm still a student of this, still learning a lot about this. The way that we breathe, in terms of the structures involved in it, we want to breathe using the most efficient way of getting air in and out of your body, and that would be using your diaphragm, and then less dominantly all of the other muscles that contribute to breathing. So many of us, because of there's a whole different number of inputs into why we might breathe differently from our most efficient way. It may be injuries, it may be habitual postures, it may be psychosocial reasons, it might be a history of allergies or stuffy noses, or a whole variety of things. We want to make sure that we can get it starts with the posture, the connection between the sort of the lid of the container all the way down to the bottom of the container. So if we think about our bodies as having a lid, so at the top would be where your tongue is on your palate, so that we can align ourselves to have our breathing tube open and accessible, down to being able to have your rib cage in a position where your diaphragm sits nice and level. So your diaphragm is that sort of like a trampoline type of muscle that's at the base of your rib cage. We want to be able to have it so it's aligned nice and straight up and down instead of tilted or twisted or something like that. And then if you go all the way down to the bottom, your pelvic floor would be at the bottom. And others argue that there's also all the way down to your arches of your feet. Those are another diaphragm at the bottom. So you have all the way from your tongue down to your arches. We want them all to be able to come down and back up again. So you want to be able to have your tongue rest on the roof of your mouth naturally, comfortably, not forcefully. And for many of us, and I discovered this myself, I was a closed lips mouth breather. So my tongue hung inside my mouth, which changed the posture of my head. So your tongue is pulling your head forward, which changed your access to your breathing tube. But also, if your tongue isn't on the roof of your mouth, you're also blocking it a little bit. So I started off working with that, being able to swallow without my tongue dangling in my mouth, these sorts of things. And then learning how to breathe less frequently. So being able to not breathe sort of hyperventilating, but slowing it down and breathing only the amounts that you need to. So those techniques about the tongue, the breathing apparatus, the breathing rate would be ɓătăică method. So if you're interested in that, that's where I learned that. Yes, taping your mouth, exactly. Yeah. And breath holding as well is part of that. And then the piston science, which is Julie Wieb's brainchild. So she's a physio somewhere in the US. She's a professor as well. That would be stacking the diaphragm and the pelvic floor on top of each other. So you have a piston of pressure. As the air comes in, the pressure is pushed down on the piston. So the top and bottom of the piston are able to go down. Then they're able to retract back up again on your exhale. So having this piston go up and down. So if things are off kilter, the pressure is being pushed in a different weird way. That could be a shoulder up here is upset or a knee down here is upset, those sorts of things. So being able to align those so you can breathe well like that. So then when you do more challenging things in different positions, your body can recruit those muscles, even if you're tilted, even if you're rotating, you're running, you're doing these sorts of things. You've educated it on this structure, being able to have that piston and that 360 degrees. So those are sorts of the ways that I've gone through that, as well as Postural Restoration Institute's, the course that I've just recently taken. And so I'm trying to understand that difference in your body, that your body might be, your liver is heavy, and so you're compensating around that. And so this structure that we tend to live in, this sort of off-kilter position that now I see everywhere because I've been studying these things, being able to get you out of that position, being able to use muscles to open ribs that have been closed chronically, and being able to get airflow into spaces that are missing, to be able to use both sides of your lungs rather than relying just on one, and being able to then unravel and have better alignment, and then access to those spaces that you haven't had access to in a long time. So sort of long-winded way of talking about breathing, sort of where I've gone, as well as Wim Hof and things that I've explored, which are more mindfulness versions of the breathing rather than just the biomechanics. Mm-hmm.
Yeah, for sure. And I think you touched on there the pelvic floor. So I don't know about the people that come to see you. I have a few women that come in to see me, and pelvic floor issues, which are traditionally dealt with Kegels, which I hate, because it's not all about Kegels. It's not all about that. Really, if people can listen to this today and take one thing home, it's not all about the Kegels, because sometimes you can have an overactive pelvic floor, or you can have a nervous issue going on down there, and doing those Kegels is actually aggravating that problem. So one thing I really like that you touched on there was like the piston movement, so the diaphragms, that the pelvic floor actually works in conjunction with the respiratory diaphragm. So how would you work with people that, pain management, for instance, with the breathing?
So this is one of the most fascinating things, is that when I work with people, everyone without question gets breathing retraining. Because not only is it helping all the things that I just talked about, it also calms you down. So when you go into a space that's painful, that you're rehabbing, it's less painful, because you're teaching your body to calm down and realize that I don't need to protect the human, that all is well. And it's fascinating that I'll have, as with my physio assistant hat on, I'd be working with people with shoulder rehabs and a whole variety of different types of injuries. And if we ask them to do a rehab exercise and they say, okay, I'm getting pain on that threshold at that range, then I ask them, okay, do your what we call core breathing. So do your core breathing exercise, which is essentially what I was talking about with the piston and the breathing. If we get you to do that, try it again, do your core breathing. They can go farther with less pain. And the more they practice it, the more they're able to get out of getting more range out of their movement that they're rehabbing without the pain threshold hitting and stopping them. It's fascinating that simply showing your nervous system that all is well through breath can mean that your body will start accepting the range of motion that is now safe, so that it won't send off those pain signals quite as quickly. And you can get more into that range, which means you can strengthen that. You can get stronger. You can start accessing and using that movement again, rather than thinking, well, this is it for me. I'm never going to move that shoulder like that. No, because we want to show your nervous system it's safe. And breath is one of the easiest, quickest inroads. And probably the most, most people wouldn't think of that the way I'm breathing. And if you're hurt, you're holding your breath and you're, these sorts of things. And that's just a reflexive response that we have. And if you can get yourself into the opposite breath of that, that's the opposite of I'm in pain. And that's what your body will start enjoying.
For sure. And what you're talking about there is like everything is all interlinked, going back to what you were saying right at the start, how we tap into these systems and we don't know what we don't know, but our body knows, and our body is trying to tell us these things. So when we are doing that pain face and the shoulders come up and so on, it's actually your body's not feeling safe. If we can then do the breath work, put you into that safe state, actually it finds things a whole lot easier because we get back into that flow. Oh, it's amazing.
It's all coming around.
Absolutely. So it's not just about the movements then, it's about the breath, it's about everything kind of being interlinked. So if there's somebody listening to this right now and they're in pain or they've got some kind of issue going on, what would be your number one tip for them, regardless of kind of where the pain is? Or you can decide where the pain is and give them a tip for shoulder pain or something like that. What would be your number one tip for them?
I would get curious first about why they're in pain. So for some people, it might be, I got hit by something and so I'm injured. But if it's not, if it's something that it's a niggling pain that's been creeping in and you've been chasing it and not being able to figure out why you're in pain, then I want you to ask yourself, what happened before that may be those connections, like we were talking at the beginning? What is it that might connect the dots between these things? So if my knee started hurting me, what happened just before that? Did I fall? Did I, what was the events that led up to that? That wasn't necessarily that I got banged on the knee, but what was the thing that happened that your knee pain started creeping in? So I want you to get curious about it. And if it's something that's been niggling you for a long time, I want you to get curious about how you are moving that part. So if your right knee hurts, your left knee probably doesn't hurt. So you can use your left knee as the teacher and your right knee as the student. So the not hurting part is probably moving better than the hurting part. So if you get curious about how is that knee moving, what does it feel like? Can I mimic that on the other side? Maybe that's the information that right knee needs to figure itself out of this problem. And sometimes simply noticing those sorts of things will lead you somewhere else. You're like, oh, also my left hip moves differently. So I wonder, does my right hip move? Wait, my left foot feels completely different than my right foot. So it's get the curiosity ball rolling and getting you wondering why that is. And one of our AIM mentors, Chris, I think Chris came up with this idea that before we had doctors and kinesiologists and people that understand these things, what would we have done? What would we have done to help ourselves out of these problems? Well, we would have moved more. So we probably would have had more awareness of ourselves and been more active and more resilient. But also, you would have just went, well, if this thing's hurting, what other things do I know about this part? I know that I have the opposite part. So I have the left knee that can inform my right knee. So we have the tools there. We just don't know that we already have this information. And we don't know that our body's factory settings are in there. They've just been conveniently wiped or grayed out because we don't want you to know that moving the knee in that way hurt. So that knee movement doesn't exist, because if it did, it hurt. So let's just forget about it, because you got other things to worry about, like getting food, finding mates, building the shelter because it's getting dark, right? These sorts of things.
Sure.
So our nervous system will gray out things from our awareness, but you still have that blueprint installed in the other knee, right? So just getting curious is what I would say. Is you already have the information in your body. It's just that that glaring pain is screaming at you and you can't see that that information is somewhere else.
I think that's a fantastic tip. Like you say, most of us are so out of touch with what's going on inside ourselves that we pass the responsibility onto someone else to fix us, where actually everything lies within us. And we just need to access that information. So yeah, fantastic tip. Okay, so my last question, and it's a question that I ask to everybody that comes onto the podcast, is what does mindful wellness mean to you?
Mindful wellness. Well, it means to me being aware of the things that are going on in yourself. So maybe that's psychosocial, like knowing what my triggers are, knowing my behavioral patterns, knowing knowing who I am, my inner child, all those sorts of things. Being able to understand how those things connect to how well you're feeling. And so part of it is the behavioral, the psychological parts of it, of understanding that my wellness is my own, is an inside job, right? Knowing how to keep myself well is something that I have my own power over, that I can take charge of that. I don't have to rely necessarily on someone else, but I can be in charge of that. I can be empowered to do that. It also means being able to know my body really well. So being curious, being open-minded, and being able to understand it better so that I know when it whispers what it's talking about, rather than what I used to do, which is, okay, you know what? I have pulled this back muscle so many times. I'm so frustrated. I'm going to go for yet another massage, right? It's that, well, there's a reason why that keeps happening. Maybe we should figure that out, and going into that deep dive, that process of figuring it out. So mindful wellness is about my mind, but also understanding my body so that I can keep it well. So I can keep doing all the things I want to do when I get older, instead of, well, I really should have looked at that when it was bothering me, and now I'm really in a deep hole. So being able to just be mindful and pay attention, and a daily practice of just noticing what's going on in your body. I have so many people who come in and like, my very first question is, how's your body feeling today? And a lot of them are like, I'm not sure. Like, well, how's it been this week? Not, I don't know. Like, well, how do you not know?
For sure.
It's
I think it's
taking that time.
You ask people, and most of us, we're not paying attention.
Nope, we're not, because we have other really heavily pressing needs in our society that require us to show up for things rather than showing up for ourselves. And it's just getting worse and worse and worse. And now it becomes a quick pill, a surgery, a practitioner who can, I'm going to lay there, you're going to fix me. And it takes all your power away. It prevents you from just keeping yourself well. And then, was it someone once said, being sick is a full-time job.
Yeah.
Full-time job. I see people in the clinic that are unwell, and it's your whole life is taken over by trying to get better, when we could just take the time to understand our bodies and listen to them and know what to listen for. And that's my practice, is also bringing back that ability for you to listen and understand your body. Like, oh, a knee is supposed to do that. Who taught me that my knee isn't supposed to do that? And so there's so many of those moments that people have with me, like, okay, I had no idea. Everyone says that. My brain has exploded because you've just taught me all these things, and I had no idea any of these things about my body, and yet I live in it. I wish that wasn't the case. I wish we were the experts on our bodies and that we had the vocabulary to do that and the vocabulary to know what kind of practitioner can help you with those things.
For sure.
But I wish
Although I do
we could
think
have
times
that.
are changing. Times are changing.
Good.
Oh, Holly, this has been absolutely fantastic. Thank you so much for your time today. So,
My pleasure.
if you would like to find out a little bit more about Holly and the way she works, you can go to www.𝚎𝚐𝚒𝚒𝚒𝚑, and I believe you're on Facebook and Instagram as Flow Movement Therapy.
Yes, and I have a YouTube channel that's full of lots of good tutorials for a whole bunch of different types of things. So you can get a sense of how I work, but also get into your own deep dives and start trying out some of these things and my thought process and how I think about these things and the sort of cueing that I use. So you get a chance to try it out too. So you can try those things out.
Awesome. I'll add that link to the show notes then.
Fantastic.
So thank you for joining us today.
Thank you for having me.
Thank you for listening to today's episode of the Simply Mindful Wellness podcast. Join us next time for a new episode.